Our next session is a panel discussion on One Health, Many Perspectives, Rethinking the Scarcity Narrative to Find Abundance. This is a pre-recorded conversation between members of our steering committee, after which we will have a live Q&A with our panelists. So enjoy, everyone. Okay, welcome panelists and audience members. It's a pleasure to have you all on for this special discussion on One Health, Many Perspectives, Rethinking the Scarcity Narrative to Find Abundance. Before we begin, I'd like to provide some context on why we are having this discussion and how it came about. This entire conference is about integrating systems of care, and we pride ourselves in being highly practical in nature. What are the existing models, and what can you borrow from them to apply to your own communities and practices? As the steering committee thought through the various ways to present these ideas and examples of integrated care, we realized that there was a fundamental conversation missing from our agenda that must be had in conjunction with advocating for integrated systems of care. This essentially became another dimension of the conversation on access to care. It's not just about affordability, but about supply. We can advocate for more collaborative, accessible systems that effectively support people, animals, and their homes. But there is a material reality that there is a shortage of human healthcare workers, a shortage of veterinarians, and a shortage of affordable housing. That conversation evolved yet another dimension on the concept of scarcity. All of us in our respective fields and our specialized perspectives understand there to be scarcity of resources that translates into a shortage of all the things that we need to provide the quality of care that we want to. But we also came to a point where we also questioned this. Is there really scarcity, or is it a distribution problem? On the user end, who experiences scarcity? Who gets to experience abundance? On the provider end, which fields experience scarcity and which get to experience abundance? On the macro end, what policy decisions and resources and investments are made to create scarcity and abundance, and for whom? And on the very high level, and perhaps the most important realm, what mental shifts do we all need to make to transform the scarcity narrative into one of abundance? As you all can see, our conference planning steering committee meetings are riveting. We decided that this planning discussion was of tremendous value in and of itself. And there were no better people to have this discussion publicly than a selection of the people who make up the steering committee. So with that, I'd like to introduce our panel of experts from across various disciplines and perspectives, and also publicly thank each of them for the time they spent developing this conversation and the conference overall. Our panelists are Allison Cardona, Anne English, Jillian McMillian, and Vickie Ramirez. Allison Cardona is the California State Director for the University of California, Davis Koret Shelter Medicine Program. Prior to joining UC Davis, she worked for nearly 5 years as Deputy Director for the Los Angeles County Department of Animal Care and Control. In that role, she also served as liaison to the county's homeless initiative, ensuring that people experiencing homelessness have options and resources for their pets. Before moving to Los Angeles, Allison spent 14 years as a senior program director at the ASPCA in a variety of departments. Next, we have Anne English, who is a founding board member of My Dog Is My Home. She believes strongly in the impact of storytelling for personal transformation and community change. She has been developing and leading innovative programs for over 2 decades in the Los Angeles homeless services sector for many of the largest providers of supportive housing. In 2008, while working as the Hollywood Area Director for People Assisting the Homeless, or PATH, and in partnership with Paws LA, she opened PATH Hollywood's Petco Place, the first formally sanctioned companion animal program within a homeless shelter in Los Angeles. Also joining us is Jillian McMillian. Jillian is a volunteer and storyteller for My Dog Is My Home and a fierce advocate for people experiencing homelessness. Jillian and her family have personally experienced a lack of resources and support during their stay in emergency housing, resulting in the loss of their 3 cats during those already traumatic years. With much gratitude for the love, support, and encouragement of her peers, Jillian has passed her cat training course and is ready to change the world. She plans to use her certification to help solidify the security of keeping human-animal families together, because no one should have to choose between life and love. Thank you for being with us, Jillian. And last but not least, we have Vickie Ramirez. Vickie Ramirez is the University of Washington coordinator for the One Health Clinic and senior research coordinator and center manager of the UW Center for One Health Research. As a medical anthropologist, Vickie is always looking at ways to improve health access and outcomes to those communities often marginalized. Utilizing the One Health lens, which focuses on the intersection of human health, animal health, and environmental health when looking to improve health outcomes, she helps support and manage the One Health Clinic through outreach, evaluation, and dissemination of key findings to support other organizations who would like to use a One Health lens in clinical care. So thank you for being with us, Vickie. And my first question is for you. So as the person sitting at the nexus of all of these fields, human healthcare, veterinary medicine, and housing and homelessness, what is your understanding of the availability of resources in these fields and how they are distributed? What is causing this so-called scarcity of resources, and how does this impact the fields we work in?
Great. Thanks, Christine. Yeah, those are very, very big questions. And being able to collaborate with everyone within human, animal, and homeless services, I've had an opportunity to see, at least in my community, where I'm based out of Seattle in Washington, all the kind of disparate accesses to resources and how resources are distributed, just like we're talking about today. And clearly the most obvious is financial. And when we're talking about financial resource, I feel like we also have to consider where we are based in the world. Are we in an urban area of a coastal state? Are we in a rural area of an internal state? Are we international? So when you look at where resources go, at least in the urban area, you find that some groups are getting a lot of financial resources and other groups are getting very, very little. And we're put in a situation where we're all feeling that we need to compete for these scarce resources. And so when you look past financial, and it's all financial, but there's subcategories of financial, right? So you referenced, Christine, earlier that we're losing healthcare providers, we're losing veterinarians, we're losing human healthcare providers, particularly after the COVID outbreak. We're losing case managers, but it's all financial. So the distribution of funds tend to go to the most highest economic groups, and the lowest amount of funds go to the lowest side. And so that trickles down to person power, that trickles down to even education. Like, education is a resource that is not provided for a lot of people. It is a challenging situation for sure. And it definitely impacts the fields that we are. So we have constant turnover. I'm sure everyone on this presentation right now knows how you get a relationship with someone for 3 months and then they burn out due to depression or anxiety or any other kind of like being paid poorly for having like 50 cases in your case management load. So it definitely affects at least a lot of the communities and a lot of the organizations that I work with closely. which is why when we use a One Health lens, we're able to connect all of these folks who have minimal amounts of funding, and then we can like make that funding stretch much farther than I would be able to do by myself.
I mean, I so resonate with all of it and feel like in this, I don't want to get ahead of myself or the conversation, but in the fields of housing, obviously, and homelessness, for years we've kind of operated in this space of it's like power hoarding and resource hoarding, right? That the way that at least government funding and a lot of public funding is set up to encourage competition rather than collaboration. And unfortunately, what happens is that those are not the right outcomes because no one person can do everything, right? And so that's just a lot of what it reminds me of, that whole competition versus collaboration thing. And I think, the hope is that we can work through those challenges. And it's great to see like the One Health community really starting to take hold. And because that is, and now that people are talking more about intersectionality and all of those things, I'm hoping that that sort of in some way um, uh, encourages the public sector to really look at the way that they distribute resources. So,
Yeah, I would just add, Vickie, I love the way you kicked it off by framing it as a financial, because I do think there can be almost like a panic mindset, right? Like there's not enough to go around. And especially when there's a narrative of like in the animal well-being space, like there aren't enough veterinarians, there aren't enough veterinary clinics. And as you were talking, I was even thinking about the LA County animal care and control system that I worked in, where there's 7 different shelters across this vast county. And even within that shelter system, how differently funded the different shelters are, right? And also that there was an opportunity for the public to donate, and they would very readily donate to a shelter that was in a wealthier area, that had a big volunteer base, that had a lot of resources in the community. Whereas some of the shelters in less resource areas were vilified in many ways. And it's the same system, right? It's the same agency. So it just really, that struck me, and how important the narrative is and what's being communicated, which I think also speaks to your collaborative piece.
Yeah, just to follow up really quick, I'm sorry. I think that's why it's a really good opportunity for those organizations that have a marketing team to be able to pull in all that money, work with the other organizations that are really boots on the floor in order to get motion and traction.
Well, the funny thing is I can always bring everything back to the mental health system because I have so much experience in there, which was fun. But see, this really strikes me in like a very hard way, where I have complex PTSD, and a lot of the symptoms for that is based on your nervous system. Now, to get most of the help that I need, that I know that I need working on my nervous system, I have to have a lot of money. I want to see a somatic coach. I want to learn how to work through a lot of my traumas. I want to try different things to hit different angles and maybe learn a new way to cope and live and keep my health in check. But I'm low income. I can't do that. So it's just, do I grin and bear it? Do I start screaming from the rooftops, I need help? Or what do I do? So that's the connection I get here, is there are levels to it, and you have to figure out a way to be able to have it accessible to everyone, have everything that's needed within arm's reach of everyone.
Thank you, everyone, for contributing to that really impactful discussion. So I have another question here for you, Allison. In your role, you have contact with hundreds of animal shelters with varying levels of financial resources, as you previously mentioned as well. From your vantage point, I'm sure you also see great creativity and the leveraging of non-traditional resources to not only make ends meet, but to do more than that, more than make ends meet, to make magic even. So what can your field do to shift from a scarcity mindset to one of abundance? And what are a couple of examples of innovation that you've seen?
I love this question. And yes, for context, we're a granting organization to California animal shelters. We've been working for the last 2.5 years on that. And it's really been, something that's consistent. It's like, what do we do when we have to drive 2 hours to a veterinary clinic, or the only clinic or resources in our community is out of reach for the people living in our community? And I've really seen incredible collaboration. I think pooling of resources, thinking about shared resources in terms of transport, that's such a huge barrier for folks. So, if one organization has a van doing collaborative transports to medical clinics, things like that. Something I've seen at the intersection of animal sheltering and homelessness and housing and human services is really getting innovative in terms of prioritization. And when I say that, it's learning more about what's going on with the person and their situation. So there's a great program at the City of Sacramento Front Street Shelter, Homeless Outreach Assistance Program. And they really work to see, okay, is there someone who maybe is about to get into housing and has a pet, and maybe the pet is pregnant, right? And so we're going to prioritize them to get spay neuter because they're about to get housed. So really getting creative with how resources are allocated. And I also, what I appreciated about them as well, that I think is a framework for funders, but also for people doing the work, is that our outcomes have to look different. And what we are asking people has to be different. Because if we were to say to a group like that, like, this is about the numbers, and you have to get as many spay neuters as you can. When we had our first check-in with them, they're like, hey, we actually haven't done as many spay neuter surgeries as you would think. But what it took to get each of those spay neuter surgeries, the engagement with the person, the transportation, the scheduling, the communication, because maybe they don't have a phone. So each of those surgeries is really this whole ecosystem of care and interaction. And so as a funder or as even someone donating, we want to be able to reframe that to say, this is meaningful work that's happening that's also now creating trust in the community, where people are telling other people, hey, you can go to them, and this is a good organization. So I think that's something creatively like we have to look at in terms of how we measure things, especially when there are fewer resources like that. And the other thing that I would say is what I'm seeing folks get creative about is requirements. There's something I have to say, I love my animal well-being space. We can be a little bit strict. We can put up some barriers. There can be some ideas of like what an ideal home is and what we want to see a pet, the type of conditions living in, and really opening up creatively our minds to say a human and pet bond looks different to different people, and we want to preserve what that looks like for someone. So requiring spay neuter is not going to, for services, is not going to preserve that bond necessarily. So how do we remove those barriers and really make it about the interaction with the human, the pet, and whatever it is they need? So we've seen a ton of shelters and programs remove those requirements and all of a sudden be like, oh, we're really being able to engage. And what they're finding, and I think this is the long term, gain of that is like a lot of people do eventually want to do that. Maybe want to get spay neuter or want to get microchipped or want to, but it really takes some level of trust and of time, of investment of time. So I really appreciate also that you talked about power hoarding, Vickie, with like resource hoarding too, right? And I think the other creative thing that we've seen is veterinary professionals providing resources in terms of education freely. What can you do in the situation that you're in? You might not be in a home, you might be living in your car, you might be in temporary housing. So what's going to work for you and your pet in terms of care for them so that we can keep you together? So those are some examples I've seen.
Thank you, Allison. There are a couple of really interesting things that I just want to re-highlight for everyone in the panel and also just listening from the audience. So you talked about building trust both in the community, but also like I feel like there's a significant trust that the funder has to put in the grantee to look at what they funded and change the way that they're measuring impact and seeing that that is a value and not just looking at the quantitative, but like really the qualitative. I think that's really very interesting. And I'm curious to hear what other people have to say about that.
Yeah, I wanted to go back and just touch on the kind of funder level thing. I really appreciated what you said, Allison, about that, about shifting how we measure impact and success. And I had, in my last position, had a very strong relationship with our largest funder and saw how they, through over time, really were shifting how they were looking at outcomes. That, no longer was it about outputs and numbers, like they really wanted to measure impact. And, and it was tough because they didn't really know how, and so all of that is a learning, but it was obvious that they saw how much that meant in terms of where they're investing their resources, that there is much greater to be found from investing resources that are, in communities, in people that, where you can see the impact and the ripple effect. So anyway, I do think people are having that conversation, but again, it's a very strong, the philanthropy community has been, very much about that sort of thing, about making sure that they're checking them, that's just the way we've always done it. So it's hard for people to shift out of that. So I think those things are happening. And, I sort of feel like some of the resources or some of the ways of doing the work that we do, for example, in Los Angeles, there's just an odd assortment of folks, at least that I know, in the housing and homelessness community, that just by virtue of the fact that there isn't anything there, that there isn't a collaborative or there isn't, that point person, have just kind of stitched together this sort of community of folks where if something comes up, that's we're going to contact all these people, and it's kind of happened organically, and it's not the best way to do it. I mean, I think the important takeaway is that these sorts of collaboratives should be funded because obviously there are so many folks that fall through the cracks of what we have in place, and we've been just sort of ad-libbing how we can make those things work. And obviously it would be much greater impact if we were able to do that intentionally, right? So I don't know.
Can I jump in really
Go
quick?
ahead.
In Seattle, we cobbled together a collaborative. And so it was a network of about 15 of us who are veterinary providers, housing, animal supplies. And so everyone was connected. So in one case, we had a young adult whose dog needed a surgery. And so Rainier Animal Fund gave some funds. Seattle Animal Shelter gave some funds. One Health provided some funds. And then Seattle Dogs Homeless Program gave toys for when the dog was recovering. another organization, actually she's an individual, brought food. And so everyone was coming together to create this in kind of what you said, like that kind of organic network type of a way. And we've been able to transition to help Seattle Humane set up a structured collaborative. There's a Slack channel that is all day as long as we have a pyro. Who can do it? I can do it. You can do it. I need this. Who needs that? I have all these supplies. Can I get you some? And so within Seattle, we've become a very strong, cohesive network. Oops, I forgot to mention Doni. Doni helped too. And what was really important was that we then shared about it on all the various social medias. So it wasn't like, I helped this dog and now they're all so better. Instead, it was like all these people came together and we worked together and look, and now this person's housed. So that's like an opportunity.
Yeah, fantastic. And what I would ask is, why aren't, public funders, government funders, and even private foundations investing in that sort of engagement and collaboration?
Absolutely.
Yeah.
All right, Jillian, I have a question for you. So we have a unique and captive audience here at the conference. I am convinced that they are the best in their fields. Now, how do we make this somewhat lofty conversation about scarcity and abundance into a call to action for our audience of movers and shakers, so that it impacts real people in the real world? So my question for you is, what is an impactful action people at this conference can take to move us towards abundance?
Wow, so loaded. Such a great, loaded, explosive question. As I have a plane flying by, so we have extra noise. Unity. I think when I think of how separated and divided and silently all these fields are, I picture being in the 6th grade at the dance, and all the boys are on one side and all the girls are on the other side, and the dance floor is totally empty, all afraid to say, I want to go dance with that girl, or I want to go have fun in that corner, or, afraid to do whatever it is to have a good time. And I relate that to, I don't know if that's the word I want to say, but I do see that there is a division, almost as if we are afraid to work together. It's a matter of just throwing something, have a community party. Make a phone call to somebody, if you're working in animal welfare, well-being, and you happen to know somebody that knows somebody that is a care coordinator and works with somebody who happens to have pets, and, give a call and say, well, what can I do, or what can we do together to make sure that your client, or perhaps my future client, can live comfortably, can live a healthy, productive life, and feel safe that they and their pets and the whole family can live a healthy and comfortable, decent life. It's just a matter of reaching out. I find that division I don't think it's intentional. I just feel that we are kind of so busy tiptoeing in our own spaces that we're afraid to cross lines. And anybody here who's in health and human services, I would advise you to maybe send a little chat message to somebody that's on the list here, that is in animal welfare and animal well-being. Just say hello. What got you into animal well-being? What got you into this field? Or vice versa. And also ask yourself, if you've never considered co-sheltering, or if you have considered it and don't know where to begin, picture yourself in a situation where you may have, I'm sorry to bring it all dark, but you may have lost your home. Maybe you got ill and you couldn't work anymore, and you might need to go into a shelter or stay with a friend. And at that place that you're going to, they're saying, oh, well, I can't deal with, I'm allergic to cats. So now you have to figure out what you're going to do, right? So let's just step into each other's shoes and even to our own skin a little deeper and think, what would I need in that situation? And what ideas do I have that can possibly work for anybody in this situation? And then just go with it. There's no wrong answers. It's hypothetical. And it's all about learning, and it's all about making connections. What's the worst that can happen?
I so love that, Jillian. I love everything you just said. And I think so much, again, it goes back to, for me, the mentality of, that everything is very transactional as opposed to relational. And so, that is how we have structured our, the way that we operate. And everything, I mean, so it doesn't lend itself to building these kinds of partnerships. And what we must do in order to get to the next level is to really focus on those relational things. And it's not, I mean, exactly what you're saying is how it starts. And people, yes, are afraid or it's uncomfortable or it's unfamiliar. And the truth is that it's something that needs you. That's just the first step, right? Because you need to build relationship with the people that you are partnering with in order to build the relationships with the people that you're hoping to serve, right? And all of those things are only difficult because they are unfamiliar and not the way that we've done things. We're really all about finding quick solutions or band-aids or all of that. Let's take care of this thing and get it out of the way. Okay, they're housed, done, that kind of thing. And, that's just not how humans thrive. It just doesn't work that way. And there's so much, like you said, complexity to all of the folks that, are not only the people that we are working with, but also people that are in the work and doing the work. Yeah, I just loved what you said, Jillian.
It's also, though, it seems like it's going to be a lot more work, but it turns out to be so much less work if there's more hands involved.
Yeah. Oh, yeah. Yeah.
And so don't be afraid to make it more complicated for the brief moment.
Right.
Yes, accept the challenge, take it and run.
Well, and ask yourself, again, ask yourself, what is it? Why am I doing this? What is the ultimate, gain that we want to see from this work?
So I have an off the script question for you all, which we might just throw out after we edit this, but partnership, collaboration, like we all need those things. That is what feels just. And I think we are all on the same page when it comes to recognizing that we need to serve people and families and communities as whole entities, not just one siloed piece of them. But maybe this is just the very, very practical side of me coming out. How does being in relationship with people impact the material, what feels like material scarcity? So how does being in relationship with one another and collaboration lead to more veterinarians, more human healthcare workers, more affordable housing?
I think with the more people you have relationships with, that sounds funny. with more people, with more force behind you, you're more encouraged to try different things. You feel possibly more supported in trying and failing. You possibly feel more inspired to try new things that you've possibly never even heard of. At least that's the hippie side of me. That's my answer.
I also think there is something to be said for, being able to leverage different ways of working and different expertise. I mean, again, not everyone, there's no one organization, and this is how it's kind of set up, that one organization is supposed to do everything. And people are not, people are much more complex. They have different needs, and there aren't, organizations that can fulfill all of those needs. And, so you need to have a deeper, a broader and a deeper bench in order to really serve people well and holistically. So it's kind of like the scarcity thing, a little bit different, that people, I think organizations often shortchange, inadvertently shortchange consumers because they feel like they must do everything in order to justify their resources, and it shouldn't be that way, right? And I think there's, yeah, I don't know if I'm answering your question, but I do think, for me anyway, it seems so much better to, I mean, it's not about the sharing. I mean, much better to collaborate with someone, share the resources, meaning the finances, and, have the better outcome, because that's going to help me, that's going to help them, that's going to help the client, So I don't know if that's what you mean, but.
I love that you asked this question, and I love the practicality of it. And it made me think of two things. One was that so much of the work that we do in any of these fields is bureaucratic, right? And like I was thinking about, we were talking to a group earlier this morning where they were like, oh, we're partnering with one homeless service provider that is pet inclusive, but there's others that say it's too much of a liability. And it's like, oh, having connection and relation, agencies can say, oh, you have concerns about liability, here's how we handled that. Oh, you don't have to rewrite anything. Here, use a template of how we got through it. This is a language that we gave to our city or county attorney, and this is, how we addressed it. So much of that bureaucracy, and I see it all the time in my role, the people sharing things of how they got through it or how they framed it to their city government. So that, I think, is huge and does free up a lot of resources and time. And then the other piece, and I think specifically in the veterinary field, is that knowledge sharing, even between practitioners. So let's say we didn't get any new veterinarians or veterinary technicians. There's a very big difference between a high quality, high volume spay-neuter surgeon and someone who's doing spay-neuter surgery in private practice. And previously, there are a lot of training programs for the high volume. And a lot of times they haven't marketed or appealed or reached out to private practitioners, thinking, well, they're not in, a spay-neuter surgery clinic. But it's like, if we teach private practitioners how to get faster, that's going to increase the number of surgeries they can do in a given day. So it's thinking that way as well, that you may have a finite number of resources, but there's always opportunities to free up space and to bring knowledge across.
And then there's also thinking about growing the veterinary world and veterinary community. So there's an organization I know of called Roots in Seattle that pays for folks to get their vet tech licenses, assuming a certain level of time as a vet assistant. And so we're trying to start a program where we get some of the youth and young adults from the shelter we work out of to become an intern through that program, and then get them all the way through so that then they leave with a vet tech license. So it's like giving folks the opportunity to see what they could become. Let people shadow you if there's interest, engage them in the vet services if you can. And that will help relieve some of the stresses that the veterinary team take on.
All right, thanks, everyone. So a lot about opportunity and education and just knowledge sharing, which actually directly translates to increased material resources and time and labor. So good stuff. Thank you. So I have another question for all of you. You are each experts in your fields. What is one question you have for any of your fellow panelists? And just to make this easy, I'm going to have Anne ask the first question of a fellow panelist.
Thanks, Christine. So I would like to ask Jillian a question. As the person that has, experienced firsthand sort of the challenges in the systems and it seems like there's so many challenges on top of challenges, and then to bring this idea of scarcity into it. I'm just curious if you talked a little bit about it, but if you can talk a little more about how like lack of coordination or fragmentation within the services system, plays out as kind of a symptom of this scarcity mindset. And, if you've seen anything that's moved the needle in any way.
What I've seen move the needle, I'm just going to start with that because it's sitting right in front of me. What everybody on this panel has done, has been a part of this organization, My Dog is My Home, spreading of ideas, the support, the encouragement to tell stories, to learn ways to support others. I've been empowered, and I've said this a lot to you guys. I've been empowered. I feel empowered. I wouldn't be on this panel if I didn't feel it from each of you. And many of the people that are in this audience, it's a matter of not feeling judged for what I've been through, for being encouraged to tell my story and encouraged to learn from it and encouraged to help others and encouraged to share my ideas on how to make things better. I don't know how I can, I can't think of anything specific in that other than what everybody involved with My Dog is My Home has been doing. Co-sheltering can solve a hell of a lot of problems. Pardon me if I wasn't allowed to say that, but it really can. We can stop a good chunk of pet surrendering. We could stop a good chunk of people feeling lonely and lost without their whole family. We can really strike a huge balance between animal and human welfare. And, I feel like co-sheltering is everything, with a little sprinkle of storytelling, of course. But yeah, this is it. And as I've said, I've said it to many people, my calling has been found just by shaking hands with Christine for the first time. The amount of opportunity to find myself, to tell my story, to find resources, to ask for help. It's all right here. So to get off of that little soft and fuzzy, cushy, squishy, dushy soapbox, I'm going to step aside to also talk about what I have seen that didn't work. What didn't work was during my situation. I didn't know who to ask about anything. I just knew I had 3 cats that I raised with my daughter from kittens to about 9 years old. I didn't know where to bring them. This one's allergic, that one doesn't like cats. I don't think I can ask this person because I don't have the courage. So I had to go on Facebook and find a stranger that would foster my babies. And I don't think that anybody should have to go through that. Most of us know how it worked out with the foster, that my babies are gone. But this co-sheltering thing can solve it all. I think it really can.
Well, thank you, Jillian, for sharing more about your story and also being a part of Team My Dog is My Home. Like, it has really been a pleasure having you with us and for you to use your leadership skills and your voice to push the movement along. I mean, I think the movement is very much enriched by having you be at the forefront of it. So thank you. I have not a question, but I am going to sort of pass the baton to Allison. Allison, do you have a question for any of your fellow panelists?
Sure. Thanks, Christine. So this is for Anne. We've talked a little bit about shifting mindsets and our approach to this work. And I'm just really curious about your own personal journey and what you can share about what that's been like.
Thanks for that, Allison. And I mean, there's so much over the years of working with folks, partnering with folks like Jillian and other folks that I've known that's really opened my mind and opened my heart in different ways. And I feel like it starts with, being curious and not just walking into every situation thinking that you know exactly what needs to happen, which is sort of how at least I have been taught or in the work of human services that, I think that is the kind of the foundation of what we do. We look for a problem, we fix the problem. That's it. And that's, again, kind of this weird power dynamic. And I mean, for example, with things like with animals and folks that I've worked with in shelter and in housing who have companion animals who maybe don't have the same ideas that I do. Like, maybe they don't want their cat spayed or neutered because that's just not that's not what they feel is right for them. And I've just realized how difficult it is a lot of the time to take my own ideas and my own beliefs out of it and recognize that I may not know what's best for this person and their situation. And I think that's a difficult thing for us to do. And oftentimes, building a relationship with someone, you learn so much more about them. And I know I've heard many times from other folks how building that relationship allowed someone to come to the place where they sort of felt the same way. And, and sometimes it does, and sometimes it doesn't. But it doesn't change the fact that this person has autonomy and choice and the right to do what they need to do if they're not harming anyone, right? So just because I feel like it's important that every animal gets fixed does not mean that I cannot be in relationship and, care about and support someone who is doing something different. And I think that's just a tough thing for us to do as providers, right? But it's been hugely impactful for me to be able to step into that space. So that's just kind of a general idea, and I see we're running out of time.
Well, thank you, Anne. We are sort of running out of time, so I'm going to pass the baton over to Jillian.
Whoopsie. Okay. My question is for Vickie. Who do you feel is missing from our discussions on distribution of resources?
Well, I'll be super fast in the interest of time. I think not for our group here, but I think first and foremost, those with lived experiences in homelessness, especially at the intersectional pieces, should be involved in all decision making and not just as a token individual this is no disrespect, even beyond storytelling. Storytelling is a component, but it's also a storytelling to build upon. And so it hurts my soul when people have advisory boards where there's no representation, or there is representation, but it's not acknowledged. It's just like, okay, I can put it on paper. So first and foremost, because I do not have lived experience in homelessness, I need to go to the experts of to decide what we should be doing as an organization. And then very quickly, what resources do people who are housed with great economics have? They have access to healthcare. They have access to to mental health care. They have access to dog training. They have access to dog behavior training. They have access to dog dental extractions, whatever. Though you be in communion with all the organizations that could bring a piece of the puzzle to improve that human health, animal health, and maintain that human-animal bond and housing as the underlying foundation.
Thank you. And Vickie, go ahead and take the last question.
Okay, great. Okay, so Allison, I'm asking you a question on, we're kind of thinking at the higher policy level changes and decision-making, and how is a scarcity mindset perpetuated or created by both policy, because you function higher up here, and what are alternatives to that can kind of solve some of these problems?
Yeah, I love what Anne said earlier about, personal beliefs and personal journeys. And I think that plays a big role, and understanding that those can influence policy, right? And so I think something about what I said earlier is really trying to make things as low barrier as possible across the board. Do I really need this for the provision of services? Who is this harming? Who is this helping? Asking those questions as a group and with people with diverse lived experiences is very, very important, because there might be something that I'm not even considering that actually is going to be really challenging for somebody to accomplish in order to get that service. So I think at the policy level, just really, and this is a plug too, it's just thinking like punitive actions are not, have not shown to be helpful, or to actually, like, if we keep thinking about what is our goal, right? If it's our goal is to keep pets and people together, then how is, penalizing someone or using a punitive measure going to accomplish that? So always being in service, and thinking, does the policy move us closer to that or farther away from it? So I think there's an opportunity to bring a lot of compassion to policy making, and understanding that it can't happen in a vacuum.
I just want to point people to, I mean, CSH did a study, I guess it's 2 years ago now, partnered and put out a study that essentially showed how we could end homelessness in California if we invested $8.1 billion a year, which seems like a lot of money, right? And people are already screaming about how much we've poured in. And the reality is it's less than 3% of the California budget, right? So I just want people, I think people don't realize that, and I just would encourage people, to check that out, and also think I'm just the whole scarcity and hoarding and, you know, that whole mindset, I just feel like it really is a lie in a lot of ways. I mean, yeah, I could go on and on. You know, we have enough food in California to feed the entire nation, but people are hungry here. So,
Right. All right. Thank you, Allison, and thank you, everyone, for your thoughtful questions to each other and also the great insights that you have shared with the audience by being in very deep discussion with each other. This was certainly not an exhaustive discussion. There's so much more to think about and talk about because we're dealing with the fundamental issues that shape how our professions get to practice. We're talking about resources, supply, workforce, distribution, among other things. So now is the time to open up the conversation to our audience members. We will be entering a Q&A period, so everyone please stay tuned in as we transition to our live audience Q&A. All right, thank you for watching, everyone. And thank you to the panelists for joining me, Vickie, Allison, Ann, and Jillian. So folks, please feel free to throw some questions in the QA box or some reflections in the chat. And as people are getting their thoughts together, I want to open by asking the panelists if there's anything that you would like to add to the conversation now that you've sort of rewatched our pre-recorded conversation. And Vickie, yeah, feel free to unmute yourself.
I just want to say that you all just experienced what we have done weekly for the last like 5 months. We would go deep into these conversations. And so that is how we ended up where we are today. I just think it's really funny, like how many of these pathways we took along the path.
Yeah, I wanted to jump in and just acknowledge right away. I saw as we were watching the recording, you know, in the questions about the phrasing of scarcity and scarcity mindset. And I hope, and that's a colonialism practice or phrasing, right? And that it's really about capitalism and greed and power hoarding. And I hope that that came through in our panel discussion, because that's absolutely, I think, where we were trying to go, is to really say it can send us into this like competition and by design, right? Like there isn't enough money, but there's definitely enough money to wage wars, and there's definitely enough money to arm, you know, law enforcement. So yeah, absolutely decolonizing and dismantling and recognizing that these systems were created to separate and divide. So I just love this group of folks, and I'm just so grateful for all the thoughtfulness that goes into everything.
yeah, I echo. Oh, go ahead, Jillian. Go ahead.
Oh, all right. I actually, you know, watching, I was coming up with all sorts of stuff. I'm like, why didn't I mention this? And the one thing that I don't have the question in front of me, but it was the one about lack of coordination. And as the question came up, I wrote down, you know, a lack of coordination leads to trauma. And with that, you know, I'm reminded of how instead of the people that I was, the staff that was at the shelter that I stayed in, instead of them looking for ways to help me keep my family together, what they were doing were actually looking for ways to get away with sidetracking the idea. So, you know, upon reflection, I remember being like emotionally so beaten down that I didn't even, you know, after a while, that last time that they asked me about the proof that I had, and then they came back and was like, oh, we can't use it. I was just so beaten by then that I was like, what am I going to do? You know? So that's my little tidbit.
Well, it's really hard to follow that. I'm so sorry that happened to you, Jillian. I feel like that is part of that, you know, the traditional way that we do things, which is putting up barriers, right? You know, instead of, you know, bringing people in, screening people in, we screen people out. You know, we find reasons to not, instead of it being our purpose to find every, you know, avenue, no wrong door. Like we've tried to pivot that, but I feel like it's so just integrated and interwoven into our traditional, you know, corporate mindset, and that's nonprofit and, you know, bureaucratic public agencies. There is a particular mindset, you know, and we're just fighting to get ourselves out of it. But I wanted to also piggyback on what folks were saying. We have so many animal themed idioms. I've got to stop saying things like that. But anyway, um, no being on pig stomachs, but um what Allison was saying earlier about the scarcity mindset and how that is indeed designed that way, and just the way that it shows us, like that thing I said at the end about, you know, we could end homelessness with, you know, in the state of California, which is the third largest state, right? We could end homelessness in California for less than 3% of our state budget, you know? So it just seems like there is something happening where people don't recognize that, yes, it's been designed that way. And as Nancy points out in our power hours, there are things we can do. We're just not told we can do them. We're not encouraged to do them. We don't find reasons to do them. And so, you know, being an advocate, learning about these things, that's how we become, you know, power. That's how we exercise our power in a democracy, which hopefully we will still have. So that is, it's so important because we are in a time when hopefully we are reckoning with these systemic injustices and doing all we can to reverse that. But that is very much the way that philanthropy, nonprofit industry and all of that have worked for a really long time. And it's not the organizations themselves, it's not the funders themselves, it's not the government itself, it's all of it, right? It's a whole ecosystem that we're fighting against. But it's up to us to get educated about it, to be prepared and do what we need to do to fight it. And, you know, we can, it's just a lot of work. Yeah.
There are a couple questions that came through in the QA box here, and I'm going to throw one of those to you, Allison. How do we talk to grant funders about the autonomy of people and their companion animals when allocating funding in our communities?
Ooh, I'm just trying to unpack this. When allocating funding in our communities. Well, I hope share this conference with folks. I see some funders in the audience too. So I know that they're opening their hearts and their minds. I think sharing qualitative data and also the quantitative, like, you know, the keynote speaker really talked about, I love the way he drilled down and was like, hey, these are the root causes of homelessness. And hey, a denominator here is high rent and proportion of rent that people are paying. So you're able to use data to combat, and that actually when abundance happens, more creates more. And I can say this as a funder as well, because we have grantees who will come to us and say, I'm really worried about spending all the money. And we're like, please spend the money. That's what it's there for. Tell us what you're learning and tell us how you're building relationships in communities. So I do think that sometimes, and I've been on both sides, right? I've been asked for money where it's like, oh, I'm not sure the funder is not going to like this. And I think sometimes those are excuses, to be honest, right? It's like that I feel uncomfortable or there's maybe something underlying that I'm not addressing that I need to. But I think that there's actually a great opportunity to educate folks that you're working with, whether it's funders, individual donors, participants, and to really open it up to say, when money flows and resources flow, we all benefit, and let's uplift everyone.
All right, there are two more questions that I want to throw out to the group, but we also want people to be able to take their break. So in answers, I'm just asking to keep them as succinct as we can so that we can get through these last two questions here. This one is for you, Vickie. Are there any of those vet tech licensing assistance programs scaling applicants to dismantle systemic racism in vet med by prioritizing BIPOC communities? Or this might be, if anyone else can answer this question also.
Well, I'll speak really quickly to that vet tech program that I was talking about. We're still in the process of setting it up, but in the process, we have had conversations about how a lot of our community may not have a high school degree. So what can we do about that? Okay, well, that's actually not an issue because you don't need a high school degree to become a vet assistant. If they do want to enter the vet tech program after 6 months of assistance, then we would be able to work with other organizations to help with the GED courses or whatever kind of thing. Okay, some of the folks who may be interested in this program, maybe they have a background in like some kind of in the justice system, you know, they're arrested for whatever. And they said, okay, well, if that's an issue, we'll take on a case-by-case basis, but we're not going to negate like their ability to participate in this program just because of that. Let's acknowledge it straight off the bat. And so with that, we're able to, with those conversations, we're able to, you know, kind of at least kind of start the process. In terms of the veterinary community as a whole, that is a whole nother problem that vet schools across the US are trying to address, because I know I have like an N of 2. I know 2 veterinarians who are of color, maybe 3, but it's terrible, and it is something that the vet schools are trying to address. But that's all I can say.
Okay, is there anything anyone else wants to add very quickly?
I just wanted to say, yes, it's 1000% an issue in the veterinary profession. I think it's less than 2% of veterinarians are Black. It's, yeah, just like so minimal. Alina Silva posted in the chat about the work that CARE is doing. There's also the Multicultural Veterinary Association, and a lot of grassroots efforts across the country to increase access directly to BIPOC folks.
And last question for anyone who wants to answer. It's so hard to think about working with other groups when we are also competing for funding. I'm not sure how to think about this concretely or really start to shift my mindset when it feels like my organization is fighting for survival. So I think the key word here is concretely. Like, we talk a lot about values and ideas, and I think we had a little bit of this conversation too, maybe internally with our keynote speaker from last year's conference, Voulet. We talked about community-centric fundraising, like, yes, partnerships, lifting each other up instead of competing, but how do you concretely make that shift in your mind? Any tips?
I'm just going to jump in. I'll try to be really fast. The one thing that I can say is, just like everything else that is essentially culture change, you just have to start doing it and keep doing it and push yourself and expand, find other people that are like-minded. And I mean, it's kind of that thing of doing what you know is right versus what, you know, the system is telling you is right or you've always done. And it just takes practice, and you know it's going to be difficult and uncomfortable, but what is the North Star, right? What is the thing you're trying to get to? And if it's to have the best program, to do the best that you can, you have to be willing, you know, to be uncomfortable sometimes, to do things differently when you find that there is a better way to do it. I don't know if that's helpful.
Yes, I think it is. So we are going to close up the Q&A period, and I want to thank the panelists and the audience for continuing this very thoughtful conversation. Before I let you go for a 15-minute break, I'd like to give you some special instructions. When you return at 5:00 p.m. Eastern Time, there is a 30-minute carve out in the agenda for you to explore our Artifact Center. This is where you'll find our portfolio of pre-recorded presentations for you all to browse and watch on demand for up to 3 months after the conference ends. You'll find a variety of topics covered there, from access to veterinary care to trauma-informed design. But we know it's hard to make time for things once your regular work schedules get started again. So when you get back from 5 p.m. to 5:30 p.m. Eastern time, this is our dedicated time for you as a group to explore the Artifact Center together during this conference and really start digging into the content that is there. So for mobile users, what you'll do is on the home screen of your Whova app, scroll down to the additional resources section, and you'll see a little button that says posters. You're going to tap that. That'll take you right to our Artifact Center. For our web browsers, on the main side menu, click Agenda and then click Posters, and that will also take you to the Artifact Center. So have a great break, everyone. And remember to start browsing the Artifact Center at 5 p.m. Eastern Time. After that, we'll see you back here in the main room at 5:30 Eastern Time. Have a great break.